healthcare to all.
Yes.
Cannot tell you how many people use our emergency rooms as their healthcare centers because they do not have doctors. They do not have money to have doctors, and they don't have any healthcare. So then their conditions get so bad that they come in, and now they go from having a mild infection in a tooth, for instance, to a massive abscess in their face is 3 times the size what it should be. Now they need IV antibiotics and the tooth extracted because they don't have dental care.
Yep. And on top of that, too, they have to, like, the payments and stuff, if they don't have, like, the insurance, like, the bills just keep piling up, you know?
Yep.
So I agree
and then
with
they
that.
can't afford that either.
Part of it, particularly, I work in Connecticut, and so in Connecticut, we don't have managed Medicaid. They do in Massachusetts, which has done a tremendous service for our folks on Medicaid. But in Connecticut, there's no managed Medicaid, which means that Medicaid patients they don't have any care management services, that they work through the health insurance companies, the managed Medicaid health insurance companies, to help better coordinate their care, make sure they're getting to appointments, make sure they're not utilizing the emergency rooms as their, basically as their doctors. And so it's really taking better care of our Medicaid folks as well as our traditional Medicare.
All right. So based on your experience in America's healthcare system, what is your opinion on the cost of healthcare?
It's expensive. It's especially expensive for patients that don't have health insurance. And if a patient can't afford a face-to-face visit with someone and traveling to a doctor's office, using telehealth services such as virtual office visits allows them to still have access to healthcare services at a lower cost for them. So I think that can help those patients that may not have access to health insurance, or cost may be a barrier. That's an alternative. And also, you know, it doesn't have to be as fancy as a virtual office visit. You know, patients can call just using a telephone to get healthcare services. It's not going to necessarily replace the face-to-face visit, but at least some healthcare services can be provided that way.
What social determinant do you think impacts an individual's health behavior the most? And are you familiar on the social determinants?
Yeah, I think part of it is the income inequality. I think is the biggest thing. Because if you look at studies of, you know, even right now with coronavirus and COVID-19, it's disproportionately affecting poor communities, African American, Hispanic communities, and it's partly not their fault. And I think, you know, having that poverty level or a low income level, you don't have access to proper nutrition or the education to find a proper nutrition, transportation to get to doctors' offices, and then just having the resources of whether it's medicine or not being able to congregate in big areas. I think that's a big thing that I think needs to change.
How do you help contribute to that in your job?
Well, as you know, going back to what I think is the main thing as an educator, I try to impart that stuff, not to put my opinions on anyone. I just try to use studies and use like information, right? Because a lot of students nowadays, whether high school or college, get a lot of their information off the internet or from social media, and they don't have the wherewithal to kind of vet what works, what doesn't work, they'll follow all these different trends of diets and exercise routines. So I try to at least give them that exposure to a wider range that they would see otherwise. But besides that, you try to just encourage them to make healthy choices, and hopefully they do that as they go forward.
So how do you help contribute to that in your job?
Well, I think one of the things, or my role is really a lot to do with technology, giving people access to healthcare through online technology. So, for instance, at Core Physicians, we have a patient portal which allows patients to access their health information, their medications. They can renew medications online. They can send emails to their physician. They can see lab test results. And that's one piece that helps people gain access to health information. It also helps them to communicate with their providers efficiently. They can send messages directly to their provider, and also just through other means of technology, such as we have a online patient intake service where patients can check in for their appointment online, and so it allows them to provide health information over the internet, and update, and allows providers to update that information, and healthcare services can be provided through that.
It's basically on like kind of healthcare for everyone.
Well, so I think that people have to come together as a nation, which I don't think that's what we're seeing right now. I think we have a real divide.
Yeah.
I think people have to understand that this is working in other countries, and that this is working in Sweden, this is working in Europe, this is working in Canada. People are fearful that they're going to be waiting for long periods of times, and they're not going to get the services that they feel that they should get.
We've been working with the state of Connecticut and also the community health centers in the state of Connecticut to help them to appreciate a better way to get their patients into working with care managers as well as into specialists, because there's a number of specialists across the state and across the country actually that don't see Medicaid patients. And so it's very difficult for Medicaid patients to get access to specialists. And so we work together with the community health centers to make sure that after they get their primary care, that if they need to see a specialist, that they can get in to see the specialist in Hartford Healthcare.